Does this sound familiar? I was walking one day and my back started to hurt, or I woke up one day and my back started to hurt, or I bent over to pick up something small and my back started to hurt. If any of these sound familiar to you, then you're not alone. Low back pain is one of the top health problems and is responsible for more years lost to disability than any other condition worldwide. Stories like this can leave someone feeling confused or scared. Today, I have 3 tips that are the hidden fix for sudden, non-specific low back pain. Welcome to my channel. My name is Chadwick Oliveira, and I'm a doctor of physical therapy. I work at McGuire Physical Therapy in Fresno, California. I'm a clinical instructor, and I have a practice based around helping those with chronic pain. I have personal experience with chronic low back pain, and I've been diagnosed with PTSD. At the beginning of this video, I gave you some examples of how non-specific low back pain can occur. Non-specific low back pain is when you are experiencing pain and there's no traumatic or disease process that we can discover that is driving the source of your pain. If the pain is severe, then go seek medical attention. If pain is mild to moderate, then these tips will help you out. If your mild to moderate pain lasts longer than a few days, then seeking the help of a medical professional may be necessary. In my experience, low back pain has happened frequently with everyday tasks like picking my child up out of the crib or putting them into a car seat. Things that you do every day and you wonder, well, did I do something wrong? Or did I injure myself in some way? And most of the time, that's just not the case. Each time I've experienced low back pain from some of these common everyday things, I've followed these tips to help me recover. Tip number 1, stay active. This means try to keep a normal activity as much as you can. Your body's alarm system has been triggered and it may need more rest to recover. If some exercise activities feel unsafe, then pursue some less intense activities. 90% of low back pain events require no medical intervention. I've experienced low back pain multiple times in my life, and usually it's due to non-specific reasons, and it gets better by simply following these tips. Tip number 2, get the best sleep that you can. Your nervous system resets and performs many maintenance functions while you're sleeping. Earlier, I said you may need to spend more time resting for you to recover. This does not mean that you stay in bed all day long. We only need, on average, about 7 to 9 hours of sleep. And if your sleep quality is good, then that's going to be all the sleep that you need to fully recover. Active rest for recovery can be going for a walk. And if that feels too uncomfortable, then you can practice breathing exercises or going through a guided meditation. Those are very good ways to de-stress your nervous system. Tip number 3 is to educate yourself. Knowledge is power and education is therapy. You want to learn everything that you can to reduce stress and fear about your condition. When we are confused and or scared, we tend to panic, and panic will amplify your problem. By educating yourself on your condition, you're not only treating your condition, but you're also, in a way, vaccinating yourself from this occurring again. Or when it happens again, you know and can recognize that it's happening and the experience is less severe. Education can start by talking to a healthcare provider. When you go to your healthcare provider for low back pain, ask them as many questions as you can to help you understand the condition. And your healthcare provider will be the best resource to help you solve your problem. They should be able to help you out with answering most or all of your questions. If they're not able to answer all your questions, then they should be able to help you find the answers and or refer you to a specialist or another provider who can answer those questions for you. one good question to ask them is if they have any books, websites, or videos that they can watch like this one, so that you can further educate yourself about low back pain. Growing up, I was a student athlete. I participated in many sports. The ones that I did the longest were tackle football and martial arts, specifically Taekwondo. And I can tell you, if you play sports, if you're into martial arts, you're going to get hurt at some point in your life. And so pain and injury are an integral part of that experience growing up. And for many athletes, they learn how to deal with pain of a certain kind. That is acute traumatic pain that is associated with an injury from the sport. However, as I got older and I had other experiences with back pain, I was once injured from a car accident after a drunk driver had hit me. And my back pain would eventually get better years later. And after that, I started to experience pain just getting my son or daughter out of their crib or putting them into the car seat. And it was really confusing to me because I did those things every day, and they weren't anything difficult for me. And so a lot of people have this experience. They come into my clinic and I ask them, hey, how did you hurt your back? And they look at me and they go, I honestly don't know. When we're experiencing pain, our alarm system has been triggered. And that triggered alarm system isn't going to turn off all of a sudden. It's not a light switch. The myth is that it's pain is a mind over matter thing. That's not true. Pain is an alarm system. And once it's been triggered, you have to take steps to turn it down, to turn it off. Most of the time we injure ourselves, pain occurs, and then it gradually goes away. It doesn't ever just turn off automatically. The myth that it's mind over matter insinuates that you have total control over it and that you can just turn it on or turn it off at will. And that's not true. You can't just turn it on or turn it off. If you found value in this video and you want to support my work, then like, share, and subscribe, and I will see you in the next video.